It's Pride Month, recognizing efforts by the LGBTQ+ community to achieve equal justice and opportunity. And a new first-of-its-kind study from the American Cancer Society looked into why cancer risk is often higher for those who identify as LGBTQ+.
Yeah, senior health correspondent Monica Robbins explains the importance of this study and really how it sheds a light on healthcare disparities.
Being part of a Pride March is one thing, but getting access to medical care as an LGBTQ+ individual can be another. That's just one thing highlighted in the new American Cancer Society report.
To have a national organization like the American Cancer Society draw attention to it, I think is an early step. The next step that comes with this is how can we structure our care delivery to address these gaps.
Dr. Sarah Lynam is a gynocologic oncologist at Seidman Cancer Center. She treats patients who've experienced obstacles in their care.
And now we're seeing it in hard facts as far as this is affecting the prevalence of cancer within the LGBTQ community. This is affecting long-term health outcomes, access to screening, and really tells us that we're paying attention to it, but we're not fixing the problem.
The study looked at cancer prevalence and modifiable risk factors in the LGBTQ+ community. For example, bisexual women are twice as likely than heterosexual women to smoke and drink heavily. Minority stress is likely a contributor to that behavior. Dr. Lynam says the report is a wake-up call to the health systems to be more inclusive.
There's somebody who's in the LGBTQ community right now who's seeing this. How this directly impacts you is that you are at increased risk. Know that you are valued and that every person has the right to healthcare access.
Dr. Lynam says inclusive language is important, but even though the report's findings suggest cancer disparities, cancer incidence and mortality numbers aren't available because sexual orientation and gender identity are not routinely collected in healthcare settings. Now, electronic medical records like MyChart may make it easier, but we still have a long way to go.
Where does Ohio stand with this issue in general?
Yeah, that's a really good question. I think a lot depends on geographical location because all of our major hospital systems in Northeast Ohio do have LGBTQ+ clinics, but access is limited in the more rural parts of the state. Also, 21% of LGBTQ+ people live in one of 10 states that have targeted religious exemption, meaning healthcare providers can refuse to serve an LGBTQ+ client, and Ohio is one of those states.
All right, Monica Robbins with a big study. Thank you for bringing that to us.
Sure.
Yeah. Appreciate you.